Hi there, welcome to familydoctor.expert, and today we're going to talk about minor head injuries. So every few weeks we have a kid come in or an adult come in who has fallen in the shower or slipped on the steps, bumped their head, may or may not have had some loss of consciousness, what we call concussion, for a few seconds, and they come in to get checked up. Now, a couple of things that you need to know about minor head injuries. First of all, most of them are going to be fine, so that's good. But secondly, it's always important to see a doctor because the brain, the skull, is actually a closed box, and in rare cases, the brain can swell or some of the little blood vessels around the brain can bleed. And because it's a closed area, you can imagine this causes a rise in pressure and a whole lot of troubles. So we're pretty careful with head injury, and even if you look at this video, you really always need to go and see a doctor and get checked properly. So what do we expect? Often people, when they've had a bump on their head, they may have some bruising, and it's a good idea to put some ice on that. Better not to put the ice straight onto the skin, usually wrap it up in a face washer. Is a good idea. Now the doctor will have a look at you, they'll check your eyes and have a look at your pupils, make sure they're equal. They'll have a look at your eye movements and make sure you've got no double vision. They'll check for any discharge or bleeding from the nose or the ears, which can be a sign of the rare event of a skull fracture or something like that, but that's very unusual as well. They'll definitely want to have a look at your neck and make sure that you haven't damaged it. Now, most people don't have to get raced off to have radiological tests, but if the doctor's worried at all, they might arrange a CT scan to have a look at your brain, or if they're worried about your neck, they might want to do an X-ray. So there's a few rules after head injuries. The first is if you've had a head injury, not to drive and to rest up. I recommend not eating for the first 6 to 12 hours or so until things have been assessed to see where you're at. Don't take sedatives. It's okay to have a little bit of Panadol or something like that, but don't take strong sedatives because that's going to confuse the situation. With kids, it's okay if they have a sleep, but they really need to be not on their own for the first 24 hours. And I recommend that you check on the children every 4 hours or so. So set the alarm, maybe even get them up to go to the toilet just to see they're moving okay. And similarly with adults, it's better if they're not on their own for the first 24 hours. So what would be some warning signs where you think, oh, this is not going well? Well, vomiting, particularly multiple episodes of vomiting, is a warning sign. Confusion, obviously fitting, weakness or spasms in the arms or legs, slurring of the speech, double vision, all these sort of things make us a bit concerned that we need to look a bit further. So if there are any of these sort of unusual things going on, then it's important to get checked by the doctor. Keep in mind that kids can get symptoms quite quickly, and people can seem fine and then deteriorate, so they really need to be kept a watch on. Now, in the long term, most people will find if they've had a significant knock on their head, they may have a few days where they're a bit moody, their memory can be a bit off, they're just not quite themselves, and we recommend that they just take it quietly during that time. If this persists, it's again important to see the doctor to make sure there's no more serious damage that has occurred. So this is just some basic ideas about head injury. As I said, keep it in perspective, most of them are fine, but we do have a level of caution to make sure that we don't miss anything. If you're worried, go and see the doctor. Don't just rely on this video. Get checked properly. Anyway, there's a little bit about minor head injuries, and I wish you well from familydoctor.expert.